briefing for Friday, May 1st. Updates on the healthcare front, the latest statistics that will drive our next phase of reopening, and a look at how the Latino community is helping one another through the crisis.
Plus, an update on proposed legislation aimed at helping the region in the new normal. A panel of experts helps us understand how to cope with COVID-19 and its social side effects at home. And when you leave home to get fresh air at the national or state parks, we have tips for how you can leave no trace.
Good morning, everyone. Thank you for joining us live online and on air for this COVID-19 weekly briefing. I'm Chris Barrett for the COVID-19 briefing team, now in our fourth week. This week we have a lot of timely information for our viewers, and we hope you'll be able to share this if you're streaming live on Facebook or on YouTube. We want to first thank Blue Ridge Cable TV 13 and East Stroudsburg University for partnering with the Pocono Mountains Visitors Bureau to bring you this program. Remember, you can get up-to-date information at our website, poconomountains.com/COVID-19. First, let's take a look at the numbers. What you're seeing right now is our cases from 4/9/20 through 4/30/20. Positive cases have gone up, and unfortunately, fatalities have gone up as well. These are numbers that we still really need to work on. Next slide, please. What it means specifically: change in cases, 43% increase from 4/9 through 4/30. Change in fatalities, 69% increase. Monroe County on 4/9 was at 70% of the case totals and 70.3% of the fatalities. Monroe County on 4/30 currently stands at 63.31 of the case totals and 61.36 of the fatalities. The Pocono Mountains on 4/9 was 5.54% of the case totals in Pennsylvania. Right now, that number is at 3.88. Next slide, please. This is a trend line and bar graph from 4/9/20 through 4/30/20 for all three counties. Next slide, please. And you can see the positive cases age range, most from 19 up through 65 plus. Next slide, please. And hospitalizations from 50 to 64 and up. Number of cases and fatalities in Pennsylvania as of 4/30. Cases, 45,763. Fatalities, unfortunately, 2,292. Negative cases, 175,602. Again, this information is at poconomountains.com/COVID-19. Joining us again are the presidents of Lehigh Valley Hospital-Pocono, Elizabeth Wise, and St. Luke's Hospital Monroe campus, Don Seiple. Both have been with us each week to provide encouraging updates on the fight against COVID-19. They can tell how each and every one of us can help and make a difference. Elizabeth, please share with us your update in respect to your health system this week.
Thank you, Chris, and good morning. I'm excited by the depth of new topics we are covering for today's program, including areas such as cultural diversity and COVID-19 coping, as well as updates from Harrisburg. Additionally, Jason Boyko, LPC, clinical coordinator and therapist for LVPG Psychiatry, will participate in a panel discussion focused on mental wellness and COVID-19. It is important that we take a comprehensive approach to combating the virus, as Chris and his team have done each week. And as this pandemic continues to shift, it is important that healthcare continues to evolve as well throughout the COVID-19 outbreak. And Lehigh Valley Health Network has been both a leader and partner in working with our community. Now, LVHN is continuing to shine in those roles as we design what the new normal for healthcare will look like. And safety has always been our top priority. Early on, we set up test and assess centers in several locations across the county. And I talked about last week how we transformed into a digital health network really overnight. And to set the wheels in motion for this next chapter, LVHN formed what is called the Emergency Recovery Operations Council, or EROC. There's always an acronym in healthcare. So EROC is ensuring everything is in place to provide the services patients need, to make sure that it's done in a safe way, and we're doing it with a heightened focus on safety as well as convenience. This is an interesting moment as we are given an unprecedented opportunity to redesign what will be the new normal in healthcare. And to sharpen our focus on safety, LVHN will redesign the patient experience by putting progressive processes in place that will support social distancing and reduce wait and face-to-face times during in-person encounters. We are assuring that patients get care safely and quickly. And starting today, LVHN will reopen more than 50 Lehigh Valley Physician Group practices and select express care locations across the region. Currently at Lehigh Valley Hospital-Pocono, we are seeing less critical care patients, particularly those that involve a breathing tube and a ventilator support. We are seeing the same numbers of patients that require medical care, but more of the patients that come in for testing are testing negative, which is a good thing, and in concert with my theme of hope that I've shared with you every week and will continue to do so. I also wanted to share a fun, celebratory, and hopeful moment inside our Lehigh Valley Hospital-Pocono walls. Early this week, our colleagues enjoyed a pop-up party featuring uplifting messages featured on posters by fellow leaders. There was some singing involved. I did not sing, which is probably a good thing. And we sang songs such as Journey's Don't Stop Believin' and the theme from the movie Rocky. It's these kind of moments that help keep hope alive.
Thank you, Elizabeth, for continuing to instill hope in each one of us. We turn now to Don Seiple, president of St. Luke's Hospital, Monroe campus, for the situation update there. Don.
Yeah, thank you, Elizabeth. You'll see I took the opportunity to build on Elizabeth's theme of hope, because I do think that is something we need to really have in this during this pandemic. But hello, everyone. I know it's May 1st, and it's not the beginning of spring, but for me it feels like it is. This past week I was talking to some of my coworkers, and I mentioned to them that how time had been flying by, and then COVID-19 hit, and time seemed to come to a complete standstill. The last 6 weeks has felt like 6 months, but I'm starting to see signs of hope. The hope that spring brings. The trees are budding, flowers are peeking out of the ground, and animals are busy at work. Like spring, we are seeing signs of hope with COVID-19 virus. In our hospitals, we continue to see a noticeable decrease in the number of patients being hospitalized due to COVID-19. The number of new COVID-19 cases in Monroe County continues to decrease, and starting today, the governor has approved the opening of some recreational businesses. During these extraordinary times, St. Luke's continues to provide extraordinary care. While we remain committed to meeting the needs of our COVID-19 patients, we are also preparing for our new normal. We are ready for you. It is extremely important that we continue to manage our health during the COVID-19 pandemic. Patients have been able to receive care from their healthcare providers through video and virtual visits, at urgent care facilities, and in the emergency department if needed. Unfortunately, many of these elective procedures that are normally available to manage our health were not accessible due to the restrictions which were put in place to fight COVID-19. Earlier this week, the Pennsylvania Secretary of Health, Dr. Rachel Levine, announced that hospitals may resume elective procedures. St. Luke's is preparing to resume these elective procedures on May 11th. Rest assured, St. Luke's is taking every precaution to ensure your safety within our hospital and our outpatient facilities, allowing you to continue to receive the care you need to keep you and your family healthy. It's time to make your health a priority again. I'm confident we will continue to see signs of hope and prosperity as your economy begins to open up and we return to our new normal. We will begin to move more freely and learn to live with COVID-19 as we continue to practice social distancing and universal masking. These simple measures have helped to flatten the curve and have minimized the impact that COVID-19 has had on our community. It is these measures that are going to allow us to coexist with COVID-19 and return to our new normal. It is important to be conscious of how this pandemic and quarantine has impacted our lives. Later in the show, our experts are going to provide some great advice on how to adjust and live within this new normal. I wish you and your family a healthy and safe week.
Thank you both for your professional guidance these past several weeks and going forward. We are blessed that these two health systems are in the Poconos, working together against our common enemy. We'll be joined by some healthcare professionals a bit later in the program to discuss how to cope with COVID-19. But first we want to take a look at one of our communities that is often impacted in different ways, whether it's due to culture or socioeconomic backgrounds. They have a great story to tell. The Latino community is banding together to overcome this crisis, and Jim Hamill with the Pocono Television Network shows us how.
Hola, 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 hola amigos, bienvenidos a Mano a Mano con Cristina Luna.
What started out as a way for Cristina Luna to bring people together and build bridges for the Latino community in the Poconos has now become a vital resource during the COVID-19 pandemic.
I could bring everybody together, bring awareness and make people feel less alone too, because if you can share what's happening to you, then people feel better about it.
The host of Café con Cristina on numerous social media platforms helps translate the latest public health and social resource information for those who speak Spanish. 14% of the population in Monroe County, 9% in Pike County.
It's important that Spanish speakers get accurate information in a timely fashion so that we're able to ensure that they're adhering to the regulations for their own safety and the safety of others around them.
Dr. Damaris Bonilla serves on the school board in East Stroudsburg and on Governor Wolf's Advisory Commission for Latino Affairs. In addition to the language barrier, Dr. Bonilla stresses the importance of helping small business owners in the Latino community and parents who may need more support to help teach their children. Professor Beatriz Villar Fernandez echoes the same message.
So what we're trying to do is to provide them with information, so we kind of connect them, and this time that you might feel a little isolated because you stay at home. And so our purpose is to kind of bring that information to them in different areas.
From podcasts to videos to weekly virtual meetings, this community is better served thanks to these and many others answering the call to help.
There's many things that you can do. You can help a neighbor. You can ask a friend, call a friend that you know is living alone. So I think that through this time, we know it's difficult, but there's something that we all can do to make it a little less difficult.
Members of Flecha, or the Federation of Latinos for Education about the Culture of Hispanic America, have been busy translating the latest public health information, even featuring regular segments with hospital officials.
But most people have homemade masks.
Luna admits it has taken time to bring awareness for many issues affecting Latinos in the Poconos, and this crisis requires whatever it takes to bridge what divides us and bring people together virtually and with a consistent message.
I realize that people watch so much TV and other information that sometimes is not too reliable, and they get all crazed and panic. So I thought, let's bring them local information and real information so that they can know what's happening and how to protect themselves and feel that somebody cares about them, because when there's a crisis and you're in survival mode, you feel very lonely and people are very edgy. So if we bring the community together and we give them the services that they need and we help them, then that's good.
One more way they're helping, encouraging takeout on Mother's Day weekend from Latino-owned restaurants in the Poconos.
Call the restaurant and pick up some food to go. It's an opportunity to access cultural food on Mother's Day weekend, still celebrate in some of those traditional ways that you're used to, not having to cook and supporting a small business while you're at it.
Jim Hamill for the Pocono Television Network.
Stand by. There are many areas of our society affected by this crisis, and lawmakers are looking to alleviate issues with directed public policy. Two of those potential issues have to do with limiting liability when businesses begin to reopen and recover, and regulating short-term rentals in the times of crisis in the Pocono Mountains. We sat down with Senator Mario Scavello at his Scott Run office for his take on these two topics.
We've had a tremendous boost in population. So folks say, well, we see a lot of New York City and New Jersey plates. You are, because the governor took about 3 weeks to ban it for a month. And unfortunately, by the time he made that step, these folks were up here for quite a while. And if you notice, we had those high numbers in the beginning. You know, when you bring in a 3-bedroom home 6 vehicles, you overpopulated that house. And if you had more than, if you had one person infected, it spread fairly quickly. And then the other piece is when you are in that many in one location, you tendency not to stay there for 14 days. You tend to move out, go into the community. And unfortunately, I believe that helped grow our numbers early on. These businesses don't realize, because they are a business, they don't realize that if we didn't nip it in the bud, if we don't slow the spread in April and early May, if we don't slow that spread down, there won't be a summer business for them, because this will continue into the summer. The idea for us is to hit it hard in the beginning, and I believe that's what the governor did. And hopefully we can see an end to it, and you see the flattening of the curve. If you see 6 vehicles in front of a house, if you see that type of stuff, go on my Facebook, put the complaint in right to the Secretary of Health. They're monitoring the addresses and everything, and I believe they're going to find themselves probably in a fine situation if it's continually going on. So there is a reporting process now, and that'll all depend on the public now reporting them. All it takes is for one person to get infected in a household, and if you got too many people in that house, well, guess what's going to happen? It's going to spread. We're asking people, really consider, follow the governor's order. Go for a couple more weeks if you can, and then you'll have a good summer, and we'll all be much healthier for it. That spread of that virus will be pretty much slowed down. That's what we're looking to do. There's no way that you can prove that you got it there. You could have brought it there. You know what I mean? Unless you were tested before you went in, you could have brought it there. It's a very difficult thing to prove. I do know that going forward, I talked to the owner of Dasaki, and I believe he was talking to the tourism folks, that the restaurants are going to have a hard time when governor says, here it is, you can start opening. First, they'll probably do, let's say, for example, they have 100 seats. They can only use 50 of them and maybe use a call-in thing. You have to have a reservation, so you're not out there waiting, and you come on the time of your reservation, you get seated. But even with all of that, there'll always be something in people's minds that maybe, do they have it or not? They don't know, So a testing procedure for all the employees in the hospitality industry, and maybe we can help with the dollars to make it happen, because I think that's what gives people a little bit more security, and maybe they'll come out sooner.
You're not hitting the prompter? Now to a new segment this week, Coping with COVID, you and your mental health. Well, this is one I think that we can all really use right now at this time, as we've been in-house, I guess you can say, for 6 weeks. We have a great panel here. This panel is going to walk us through some things and talk about, how we can cope as we move forward. So first, we're going to start with Jason Boyko. Jason from Lehigh Valley Health Network. And Jason, we're going to do this by questions and just as a conversation back and forth. So we're looking forward to having your input. And Jason, first we want to ask, why should we set expectation and goals for ourselves during this crisis?
Yeah. Well, thank you for having me, by the way. But to answer your question, I think it's always important to set expectations and goals. Oftentimes we go into situations without pausing to think about what might happen to us, what our experience could be. Many times we're in a rush to try and get to an end point. So setting expectations and goals allows us to take the time to have some insight into what might happen to us during this process. A lot of people also struggle with expectations and goals because they choose to set unrealistic expectations and goals. And I think the key is having goals that you can actually achieve. So as you try to achieve those, then you can start to build confidence. And that confidence provides you with reassurance, it lowers your anxiety, and it makes managing the unknown a lot more tolerable. So rather than saying, oh, I'm just going to bounce right into this pandemic and all of a sudden I'll handle it because that's what I always do, I handle everything, saying, hey, today I need to learn how to work from home, and that's the goal I'm going to focus on right now. So breaking it down to those realistic expectations so that we're able to build that confidence and lower that anticipatory anxiety so many of us experience.
Thank you. And I should say Jason is a clinical coordinator and therapist at Lehigh Valley Physician Group Psychiatry practice. And now Professor Paul Bartoli, where is the professor? Oh, there he is. He has something really neat to talk to us about, and that's the 5-5-5 daily strategy. Paul, what's that?
Well, thanks for having me as well. And Jason, I'm going to follow up. That was a great introduction to what I'm going to say right here is let's be a little bit more specific then about how you might be able to set some strategies for a day, just a day like today. So 5-5-5. 5 minutes every hour, make sure that you're doing some movement. We all know that this starts with physical health too. So that increases blood flow to your brain, it helps decrease anxiety, and it helps boost your immune system. Don't sit in a Zoom meeting, as I did yesterday for 3 hours, and think, take a break. Get up, and if your baseline is that you normally get up once an hour and go to the bathroom and come back, great. Stretch a little bit. Maybe the next time you get up to go to the bathroom, do a lap around the living room, do a lap around the kitchen, or better yet, go outside. It's going to be a beautiful weekend. Spend a minute outside on your way back or forth. And then the next day, stretch that a little bit more so that you're making progress in small bits every day, giving you a sense of control. So that's the first 5 minutes of movement every hour or more if you can. 5 times a day, the second 5, try to make sure that you're having meaningful interactions with other people because, of course, this has impacted our communication, our social networks, everything. Meaningful communication can be things like interactions. It can be texts. It can be online. It can certainly be in person, though, as well, which is what we're all missing a little bit more of. If you have to make a run to the grocery store and normally you would say thank you to someone working there, stretch it. Thank you for being patient as I dropped my eggs on the floor, whatever it happens to be. So you've stretched your interaction a little bit. You've taken control of that interaction, helped the other person and yourself. Meaningful interactions. They're easy to do when it's a celebration day in your family. Today is May Day. So as we know, a day that was celebrated as kind of a day of renewal. It's also my wife's birthday, so happy birthday. And so it's easy for me to celebrate today and stretch those interactions. But for you, it might be a little bit harder. So set those goals for yourself. If normally you texted a relative, a loved one, once every few weeks, text them twice a week. Increase, stretch the goals. And the last of the 5s, so we want you to take 5 opportunities every day to take something that's a challenge and turn it into a positive. Positive thinking helps your immune system, decreases stress, anxiety, just good for you all around. This is a tricky one though. So in the best of all worlds, maybe you can roll all 3 of these together. I was on my way to a large box store that will not be named right down the street to get groceries. A little bit stressful. I pull in, there's 30 or 40 people in line 6 foot apart outside and it's raining. I have to wait my turn to get in. So, what can I do? Because immediately I'm thinking, the negative thought came in. So I stop that thought, I try to set some goals. I park at the end of the parking lot. That gives me my first 5. I get to walk a little further, increase my physical activity. I am in line now in the middle of the road because the line is so long. True story. And so I take the opportunity, I make eye contact with the person in front of me in line. Normally I would nod and say hi. Nod, say hi, say, can you believe it? We're in the middle of the road while this traffic is going by waiting to go in. Make a joke about it, we have an interaction, stretch it a little bit longer. That human connection, very, very important. And then by the end of the trip, I can think to myself, wow, I took something that was originally a negative, a little thing maybe, but those are sprinkled throughout your whole day. Take that little negative, spin it into a positive, make some progress on our strategies or our goals, and I can feel like I'm taking control of this situation when so much of the world seems out of control at all times.
Thank you. And Dr. Bartoli is a professor of psychology here at ESU. Thank you, doctor. That was really good. Now I'm going to turn to another doctor, Dr. Khanani. Doctor, can you tell us, this is one that you can work with all the time, how do we manage relationships with our coworkers, especially now since we're all working from home?
Yeah. I'll reiterate the thank you for having me on and really taking on an important subject right now. I think that the key word I would use in terms of relationships with coworkers is empathy. I really think that at this time, everyone is going through so many different struggles at so many different levels and so many different layers. And we may not know what the other person is going through. You know, you're going to work, you're having a Zoom meeting with somebody, and what did they just walk in from? So remember to be very empathetic with all your communications and your interactions with people at this time, because it is a difficult time. And from day to day, it's changing for everybody. We're going through a lot of different emotions every day, so that is coming in with your coworker every day. And you know, try to be as empathetic as possible, and make it a little better for them. You know, give them an extra smile. Use one of these stretch moments that we just heard about to make the interaction more pleasant, and give a little room, because we're all going through a struggle right now.
And we are. Thank you, doctor. And doctors with St. Luke's Psychiatric Associates, doctor, that was good advice. Finally, Kate Curry. Kate, assistant professor, early childhood education at Northampton Community College, that's at the Monroe campus. And Kate, a lot of folks are at home with their kids right now. They're homeschooling them. And we hear this quite a bit. We've had a lot of people ask us to talk about this subject. So with this homeschooling, the pressures and the confusion, and it's a time of crisis, what do parents do? What do you say to those parents?
Yeah, I think one of the most important things is to remember that you're not having to take on the role of the actual teacher. Sometimes, and I've said this myself, I'm a teacher myself, I can't homeschool my own kids, that would be terrible. And it's not about being their teacher, it's about being their parent. You were their first teacher, and you don't have to set a schedule that has gym and lunch and all these things. Your job is to teach them the things that they need to know in order to be prepared for their future. And the schoolwork will still be there when all this is over, but your time with them will not be. And so I think just initially to remember that you have already been teaching them for all these years. You don't have to be their first grade teacher, you are their parent. And so to trust yourself and to give yourself a break, knowing that you already have the skills that you need to prepare them during this time.
Thank you. And I wish we had more time for this august panel with this this great advice, and we want to have you guys back again. We have a little bit more time, and we can do a little bit more research into this. But I have a feeling that this is really going to be something we're going to be talking about for a long period of time as we continue with this pandemic. And I think it's a topic that a lot of us have on our minds. So we'll thank you guys again, and we want you to stay here. We're going to have you back again. So now we're going to turn to something else, the topic of outdoor recreation. While many places remain closed, national and state parks in our area have stayed open and have been one of the only sources for comfort and stability for many of us as we grapple with the new normal. Unfortunately, that has led to some issues. Brianna Strunk with PTN shows us ways to leave no trace.
The Delaware Water Gap National Recreation Area is a beautiful place to visit this time of year, but lately,
it's been super busy in the park over the last few weeks.
Traffic may be slow today, but on weekends, it looks like this.
Because of that, it's been really hard to adhere to some of our CDC guidelines for social distancing.
National Park Service spokesperson Kathleen Sant says crowds and congestion equals trash and vandalism.
We urge you to pack out all of the trash that you bring in with you and take it home and dispose of it properly. That includes the latest form of litter, masks and gloves.
All park facilities, including bathrooms, are currently closed. An additional challenge, summer seasonal employees aren't on duty yet.
It's extremely difficult for the small staff that we have right now to be able to keep up with the increased visitation that we're seeing.
Here's some easy ways to recreate responsibly. Only park in designated areas and stay away from those that are closed. Don't participate in activities that could put you and rescue teams at risk. Plan ahead by checking the National Park Service website for important alerts. Visit during weekdays or off hours. And finally, follow guidelines by staying and recreating in your local area.
The National Park Service protects these special places for future generations, so they'll be here later when you want to come back for a visit.
And avoiding crowded areas might just pave the path for new adventure.
There are more than 150 different trails here in the park, so choose a place that's less popular and it might become your new favorite place.
For Pocono Television Network, I'm Brianna Strunk.
You're watching the COVID-19 weekly briefing here on the campus of East Stroudsburg University, brought to you by the Pocono Television Network and Blue Ridge Cable TV 13. We would like to thank especially Kim Bell, the general manager of TV 13, and Zach Booth. An additional thanks to Kurt Burton from ESU. You can also watch this live streaming on YouTube and afterward on PoconoMountains.com/COVID-19. We'll be back next week with more guests and more updates for you. Before we go, as has been our commitment, we want to say thanks to our frontline heroes who work in life-sustaining roles for all of us in this unfolding crisis. So when you come across a frontline hero, remember to stop and say thanks on behalf of all of us. I'm Chris Barrett. Thanks for watching. Do your part by being informed. Visit PoconoMountains.com/COVID-19.
State of New Jersey, the trails and parks have been completely closed. And we're seeing anywhere from like 45% increase in use to over 200% increase in use for this time of the year.
So people are following all of the rules that you've put out, but does that include things like masks? Are you seeing people with masks?